All right, well, thank you everyone for coming out. My name is Jake Canon. I'm a physical therapist at Tidewater Physical Therapy. Not to be confused with Jake from State Farm. I know. Today we're going to be talking about avoiding slips and falls and fall prevention. So if anyone has any questions throughout the presentation, just feel free to raise your hand and we'll see what we got. No, come in here.
Yeah, let's try it now.
All right, perfect. So before we get started, I have a few statistics for us. One out of every 4 older adults, 65 and older, will have a fall each year. So that number is pretty staggering. 1 out of every 5 of those falls will result in a serious injury such as a fracture. 95% of hip fractures are a result from a fall. And then the most common type of brain injury is from a fall. So it's really important for us to be making sure that we're really as safe as possible and we're really doing everything we can to prevent loss of balance and prevent falls. So today I'm going to be talking to you about a few things. The first is how aging plays a role in balance and increased risk of falling. We're also going to identify some factors that are associated with falls. We're going to identify some things at home that can increase your risk of falling and how we can modify that. I'm going to demonstrate how to get up from a fall and what to do during a fall and after a fall. And then I'm going to talk to you a little bit about how physical therapy can help improve your strength, your balance, and reduce your risk of falling. All right, so first let's talk about how aging impacts us. First, as we age, our strength tends to diminish. After the age of 30, every decade past 30, we lose 3 to 8% of our muscle mass and our strength. So we can counteract that by working on strength through exercises, working on balance through exercises, and staying active. So it's really important because with decreased strength comes decreased balance. As we age, our bone density tends to diminish. Now, this can be a problem because this can lead to brittle bones. It can lead to what's called osteopenia and osteoporosis. Now, those are brittle bones, and if we were to have a fall, that would increase our risk significantly of having a fracture. Now, the good news is, with resistance exercises and with weight-bearing exercises, we can increase our bone density, and of course with vitamin D supplements as well. So it's always a good idea if you feel like you might be at risk or if you just want to know, it's always a good idea to contact your doctor. You can get blood work done for your vitamin D levels, and you can also get a bone scan too to really see where everything is as far as your bone density, and that can identify areas of risk. As we age, our muscles and our joints, the flexibility tends to decrease as well. This is a problem because if we don't have our full range of motion, we tend to compensate in different moving patterns that can throw us off balance, and it can increase our risk of falling. How do we deal with this? We do a lot of flexibility training and a lot of strength training, and I'll get to that a little bit later on in the presentation. Also, as we age, our circulation tends to diminish. Now, this can be a problem because if we have poor circulation, it can lead to decreased blood pressure. Now, where we see this as a problem is when you go to get up from bed very quickly, sometimes you'll have some dizziness. And then when you have dizziness and you go to get up, that can lead to falls. So I always tell my patients, if you have dizziness when you go to get up from bed or from a chair, you really need to take your time to gather yourself, pump your ankles up and down, and wait a few minutes until that dizziness goes away, and then you're able to get up. As we age, our metabolic rate diminishes as well. So this can lead to increased weight, cholesterol, and increased strength on our joints. It can also lead to increased fatigue. And as we fatigue, we're not able to kind of keep ourselves upright as well as we should, and that can lead to loss of balance. We also have an increased reaction time. So by that I mean how you're able to react to external perturbations around you. So let's say you're walking in a hallway and someone nudges you. Your reaction time tends to increase by the fact that you're not able to gather yourself as quickly. And those are things that we can work on with exercise and physical therapy. So it's really important for us to kind of do some screens to figure out what exactly is going on. And as we age, we have an increased risk for disease, such as diabetes, dementia, and Parkinson's, just to name a few. Now, where we see the problem with diabetes is we tend to have decreased sensation in our extremities. We really rely on the sensation in our feet for balance. We rely on that feedback that we get from our feet to keep us upright and to let us know where exactly we are in space. With diabetes, that tends to diminish. It's called neuropathy, and that can lead to increased difficulties going up and down the stairs, increased difficulties on uneven surfaces. So it's really important for us to kind of identify what exactly is going on. In regards to Parkinson's, sorry, full question. Yes, sir.
Free loop disease. What about like hearing loss and macular degeneration, those sorts of things?
Right ahead of me. So that's perfect. So with balance, we have three systems that we really rely on. The first is our vision. We rely on the visual feedback that we get from our eyes to tell us where we are in space. We rely on our vestibular system, which is our inner ear. Now that tells us exactly where we are with our eyes closed. It gives us proprioception, kind of knowing where we are when we're in motion and when we're standing still. And last, we rely on our somatosensory system, which is the feedback that we get from our feet. Now, with diabetes and macular degeneration, or cataracts, when our vision is occluded or when it starts to diminish, that's when our balance can also deteriorate, and that's when we have an increased risk of falling. So if you feel like you're starting to see little spots that you haven't seen before, like little black spots, or starting to have blurry vision, it's always a good idea to contact your doctor, because it could be something as simple as getting a prescription for eyeglasses, and that'll help increase your balance and your vision as well. So that was a really good question.
So I have a question. So can our eye doctor make a referral to physical therapy so we can go through some of those
Yes.
balance exercises?
Yes, sir.
Well, they can.
Yep. So any licensed doctor can give you a referral for physical therapy. Now, if your eye doctor isn't able to for some reason, your primary physician can. Okay. Does that answer your question?
Thank you.
Sir? Okay, so let's identify some factors that are associated with falling and decreased balance. Muscle weakness, we already kind of touched base on this. It's pretty staggering. There's a lot of studies that show decreased grip strength increases your risk of falling by 30% in people over 65. Grip strength. So it's really important for all of us to really be doing a lot of exercises for our whole body.
What's the connection?
They're still trying to figure that out. What I'm thinking is that the grip strength is kind of a total kind of overall awareness of what's going on in the arms can affect the legs too.
One thing I would also think would be this, the greater grip strength would probably be in individuals who just are a more active lifestyle, whether their occupation or whatever it might be.
Exactly.
So increasing grip strength might relate to someone who throughout their life works a manual labor job and is
Or
very
maybe as they start doing more exercising in other ways, that's affecting it too.
Or when I go up fall, being on the ground and doing something.
Pushing out through surfaces. Yes, sir.
Or breaking your fall when you start.
Right.
That's right.
So it just gives us something else to really think about. So it's pretty wild how everything is kind of connected. And that's what we're seeing with the body and balance. Difficulties walking. I can't tell you how many times I have people come in. First thing I do in the evaluation is watch someone walk. So as soon as you come into the clinic, I'm watching you walk. I'm looking for discrepancies in your hips, your knees, and your ankles. Because if we have decreased mobility in our ankles, it's going to affect how we're walking, how we're able to plant on and off the ground, and it really can lead to loss of stability. Poor joint mobility, I know we had kind of touched base on that. We're not able to really kind of react and have that full strength and range of motion throughout our joints. It's going to lead to a lot of compensatory movement patterns that can throw us off our base of support and off our balance. And that's something that we can definitely work on and identify. We'll talk about that a little bit later on. I know Mr. Bob had brought up the question about hearing and vision loss. That was a really good question. It's definitely something that with hearing loss, it can affect our inner ear, it can also lead to vertigo and dizziness. When we have dizziness or vertigo or something going on with the inner ear, it'll affect our balance because as we talked about, our vestibular system is located in our inner ear. And that helps to keep us upright and let us know where we are in space. Vitamin D deficiency, we can do DEXA scans, we can take supplements. It's as easy as taking an over-the-counter vitamin every single day. And with vitamin D deficiency, it comes with lack of bone density. So what we talked about was resistance exercises and weight-bearing exercises. And I'll show you a few of those later on in the presentation. Low blood pressure. So it's called postural hypotension. So what will happen is when you get up from a surface such as this plinth too quickly, sometimes you'll have some dizziness. The room will start spinning. Now, that's really important to be able to identify because if you just get up out of bed and you're dizzy, you can have a fall. So I always tell people when you first get up out of bed, really take your time. Make sure you're taking your time getting up, you're gathering yourself, you're making sure you're not dizzy. And if you do have dizziness, you need to pump your ankles up and down, and that helps bring blood flow back to your body quicker. And that's something that's really easy to do. It's something that's really, really easy to get into the habit of every day. Multiple medications. This is something that is really important. If you're on 4 or more medications, your risk of falling increases significantly. Now, medications such as diuretics, antidepressants, and opioids can also increase your risk of dizziness. So if you feel like you had a medication change recently, or you're starting a new medication, and you're noticing some dizziness or just kind of overall just feelings of not feeling right, it's always a good idea to contact your doctor and just let them know what's going on. And it's something as simple as a medication change that can make you safer. Pain. I see this a lot of times in clinic. Someone will come in, they'll have knee pain or low back pain. When we're in pain, our body naturally compensates to walk in the least painful way possible. And this can lead to decreased balance, can lead to decreased stability when we're getting in and out of chairs, in and out of beds. So this is something that it's always good to get looked at. If you're having back pain, your risk of falling increases significantly because you're trying to move in ways that aren't natural for your body. So this is something that physical therapy can really help. And then last, difficulties getting in and out of chairs. This is a test that we do in clinic. It's called a 5 times stand test. What I do is just assess how much you're able, or how quickly you're able to get out of the chair 5 times. So if you're not able to get out of the chair in 30 seconds, 5 times in 30 seconds, you're at a high risk of falling. That's a direct measure of strength and endurance. So a lot of the times, I always tell people that when you're sitting in a chair, you need to push up from the armrests, and you need to bring your nose over your toes. So by that I mean you need to shift your weight forward so that when you're shifting your weight forward, you're able to see your toes, and that's going to help bring you up out of that chair quicker. Also, when you go to sit down, you need to make sure that you're reaching for behind the chair and slowly lowering yourself down. That'll help keep you a lot safer at home.
Dogs.
So these are my 2 little puppies. We're going to talk about some factors that increase your risk of falling at home. Excessive clutter on the floors or around your house. It's always. I know at my house there's dog toys everywhere, and I tend to kind of trip over them. It's always a good idea, especially in walkways, to just keep things tight. It decreases your risk of tripping, falling, and it just overall keeps you safer. Poor lighting. I can't tell you how many times I've had people come in. I had a fall last night. I got up in the middle of the night to go to the bathroom. I couldn't see where I was going, and I tripped over my dresser. So it's always, I'll talk to you a little bit about how we can modify that. But the stairs, your bedroom, hallways, wherever you feel like it's pretty dark, it's always a good idea to put some lighting in there. And that'll make you that much safer. Because as we talked about earlier, we really rely on our vision to help keep us upright. We rely on the visual feedback that we get to help keep us safe. Uneven stairs. This happens a lot of time in older homes or outside in the community. A lot of times the stairs won't be up to code. I actually had someone come in last week, they almost had a near fall because the first 3 steps were all symmetrical and the last step was 2 inches taller. And she hit her foot on the stair. She was able to catch herself, which was great. But you need to make sure that you're being aware of your surroundings and making sure that you're taking your time and using the railing going up and down stairs. This happens a lot on older homes too, no railing on the stairs. Whenever there's a railing, I want you to defer to the railing. I want you to make sure that you're using the railing. Now, it's actually a little bit harder on our muscles going down the stairs than it is going up the stairs. The reason for that is it just requires more muscle activity in the quads going down the stairs. So it's always a great idea to make sure that you're referring to the railing. Improper footwear. I know we all love slippers because they're comfortable. Sometimes those can lead to tripping and falling. So it's always a good idea to make sure that you're wearing non-slid shoes or non-skid socks. Those are always a good thing. It's always nice to make sure that if you have the slippers on, I don't like those too much, but if you have slippers, I would stop wearing them. It's just something that can really lead to bad things happening. Pets. So this is Lily on the left. She is a little terror, but she's cute. And then that's Harley on the right. Just make sure where your pets are. I know when I'm in the kitchen, if I'm washing dishes, my pets want to be right around me. They're right next to my feet. I kind of lose track where they are the whole time, and then I go to move, and they're right underneath of me. So it's always a good idea just to kind of be aware of your surroundings. If you have some pets, just kind of tell them to go away a little bit. That way you have room to walk. Uneven or slippery surfaces. I know it's February, but it's been beautiful out. We've been very fortunate not having much snow, knock on wood. But a lot of the times, especially in the morning or late at night when people go for their walks, there's black ice, there's uneven surfaces on the sidewalk. You need to make sure that you're scanning your surroundings, really taking your time to make sure that there's no ice, there's no potholes, because that's where we can really get into some trouble. All right, and then how do we make our home safer? Really, this is really important, and this is something I'm really excited about because this is something that will really increase our safety at home. Adding grab bars into the shower or the bathroom. It's always a great idea to have something to hold on to in and out of the shower, and then by the toilet as well. As you can see here, there's a grab bar right here, and then 2 in the shower. That's really good. If you think about it, I mean, when you get in the shower or out of the shower, it's going to be slippery. There's going to be wet surfaces, and they're actually pretty easy to install. They make suction cup ones, so it's not anything where someone has to come to your home and install them. Removing excessive clutter on the floors and around the house. It's always a great idea. Adding better lighting in the poorly lit areas. My wife and I actually just added a night light in our hallway because it's so dark that we were having a hard time getting around. It's something as easy as getting night lights in your bathrooms, in your bedroom. Yes, ma'am.
John and I have motion sensor lights.
That's perfect. That's even better.
All right.
Yep, that's even better. And I'm sure they're not too much on Amazon or at the store. So,
Lowe's.
yep, Lowe's is fantastic. Adding non-slip bath mats. You can do these in your shower and out of the shower. I wish this picture had one, but unfortunately it doesn't. It's always a great idea to have something firm that you can step onto when you get out of the shower. Also, kind of going back to the grab bars, when we close our eyes to put in shampoo, we can also have a lot of dizziness. Can't tell you how many people say, I have a lot of instability. I feel like I'm going to fall when I'm closing my eyes to put in shampoo. Grab bars are always a good idea to have something to hold on to keep us upright and keep us safe. Please avoid carrying things with both hands when we're going down stairs and going up the stairs. A lot of people have washing machines in their basement. They carry laundry up the stairs, and I've seen a lot of falls occur that way. So if you do have to absolutely carry something, you need to make sure that you're able to have one hand on the railing, or you need to make sure that you're having someone with you. And then keeping things eye level to avoid getting on stools and chairs. This happens a lot in the kitchen. People will say, hey, I had to reach up for the flour, I had to get up on the stool. Next thing you know, I lost my balance. So if you know you're going to use something a lot, it's always a good idea to keep it eye level, somewhere where you don't have to stand on your tippy toes, somewhere where you don't have to get on and off a stool or a chair. That's just to help you. All right, what to do during the fall? This is really important because I always have people ask me to say, hey, I had a fall a couple weeks ago, and I didn't really know what to do. I just kind of panicked and I got up. I'm going to talk to you a little bit about this, and then we're actually going to demonstrate how to get up from the fall. So the first thing you need to do after a fall is just try to calm yourself and gather yourself. All right, you want to kind of control your breathing, try not to panic, try to just make sure that you're in control. Next, what you need to do is you need to assess for injuries. Do a quick scan. Make sure you didn't hit your head. Make sure nothing's broken. After that, you need to call for help. Now, there's a multitude of ways that we can do this. I know some people they've just actually gotten Apple Watches, or they'll have their phones on them, or Life Alert. Now, if you don't have any of those devices, it's always a great idea to shout, make noise, try to get anyone's attention any way you can. After that, you're going to try to get up if you can, and I'll show you how to do that. If you're not able to get up by yourself, you need to keep your body moving to help keep your body warm, help keep that circulation. And then once we're up, if you don't have any serious injuries, you need to contact your doctor and let them know that you had a fall. And if you feel like you do have a serious injury, you need to go to the hospital. Okay? All right, so Megan and I are going to demonstrate how to get up from the fall. All right, Megan, here, we'll grab a chair, and we'll see what we got. Does anyone have any questions about anything so far?
How do you height you can use the table?
Yeah, we can use the table.
I don't get that, right?
All right, so Megan just had a fall.
The people on Zoom are not gonna be able to see this. Maybe you could push that table for closer.
There you go.
There,
Are you guys okay?
now they can see it.
Okay, perfect. All right, so Megan just had a fall. She assessed for injury. She's calmed herself. She called for help. Now, first thing she's going to do is she's going to roll onto her side. Perfect. From her side, she's going to get on her hands and knees.
Oh, all right, interesting.
There we go. Now, we're going to crawl towards a sturdy piece of furniture or a chair where we feel like we can push ourselves up. In this case, it's this plinth. Once we get to the chair, once we get to the plinth, we're going to grab it with both hands. We're going to plant our strong leg onto the ground, just like that. From there, we're going to push up from our arms and our leg, and we're going to have a seat onto the plinth. Now, this is where it's really important. We want to make sure that we're taking a few minutes to really gather our strength and assess for injuries. After this, you need to contact your doctor, or if you hit your head, or if you feel like you have a serious injury, such as a fracture, you need to go to the hospital. And that's either calling 911 or going to the ER. It's really important, especially if you hit your head. It doesn't take much to really kind of have a knock on the head and cause a brain bleed. That's when you really need to go to the hospital.
Sometimes it can take a while to show too. If you have a head injury like that, sometimes it can take an hour or two before you really start to realize that something might be wrong.
So if you start to notice increased headache, increased blurriness, problems with speaking, that's when you really need to go. It's better to be safe than sorry.
I have a question.
Yes, ma'am.
If somebody falls and, you're there with them, the first reaction is like grab somebody by the arm and try to yank them up. How would you recommend that if someone is there and they could help the person get up? How would you recommend that they do that?
That's a great question. So, the first thing to do is make sure they're okay. All right, if you think they have a serious injury, you need to call 911 and you just need to wait for the paramedics to get there. If they're saying, hey, I'm okay, I think I'm fine to get up, it's honestly a good idea, just how we showed you, and have someone along the side so that they're able to help support them and get them up, or allow them to get up. 2 is always better than 1. But if you feel like you might be at risk helping someone get up,
2 or on the floor.
yes. So, kind of what we just said, 2 is always better than 1. We don't want 2 falls from 1. So if you feel like you're able to get into a good position to help them get up, you're able to support them, that's okay. Generally, I would have them just kind of get up the way that we talked about, try to get to a sturdy piece of furniture. Then you're able to help them get up from there. But a lot of the times, my wife's a physical therapist. She actually had this happen a month ago. A lady fell at home. Her husband tried to get her up. He went down as well, and then the ambulance came. They had 2 people. So I think it's always a good idea to make sure you're aware of your surroundings. Make sure you're confident in what you're doing. But that we know that furniture is probably not going anywhere. It's nice and sturdy. And when they get to the edge of the furniture, you can be here to kind of help get them up, make sure that they're sitting down, and then really assess for injuries and see what other medical attention is
So
necessary.
can you demonstrate the method when there is no piece of furniture, you're out walking and you fall, and John knocks you over or something? So,
It's gonna be the same, thing. It's gonna be a little bit harder. So you're gonna try to get on your side. You're gonna wanna try to crawl to where, if there's anything elevated, worst case scenario,
Even a tree.
curb, anything where you feel like you're able to push yourself up, that's gonna be a good idea. So, side, crawl, and then absolutely worst case scenario, there is nothing to be able to push yourself up on. Hopefully at that point, someone will see you, especially just around here, someone will see you, they'll help you, or they'll call 911. If it's a long time, no one comes, you need to gather yourself, try to get your strength. And then we're kind of right here, pushing up on your strong leg, pushing through, can everyone see me? Pushing through your hands, pushing through your legs, trying to stand up and get your balance. So I'll kind of talk about what we can do as far as exercises later on to really help increase that strength. But that's absolute kind of worst case scenario, no one around. Does that help you out? Yes, ma'am.
Can you still call 911 and just to have them pick you up and not transport?
Absolutely.
Okay,
Yes, ma'am.
because a lot, folks end up doing that. And you can do that in your community. And generally the husband, but they need to know that, and they learn very quickly, they can't pick their husband up, or they can't pick the right
or they can't break the fall.
And then the other thing is to, if someone's trying to help you to get up, you're embarrassed, you're trying to, okay, just tell them, give me a minute.
Yeah.
Just give me a minute.
Exactly.
Stand by here, see what I need, but just let me regroup. And when we're embarrassed, we don't do that. We're just like, okay, thanks. You know, and so because there's a lot of anxiety and emotion, especially if you've fallen before and now you fall again. You really are concerned that this time you really did it.
Absolutely. So it's kind of like what you were alluding to. Always need to make sure that we're gathering ourselves. We're in control. We're trying to control the moment, focus on our breathing and making sure we're not getting overwhelmed. So it's a fantastic point. Yes, ma'am.
So 2 months ago, I fell right outside of Acme. And I knew when I went down that I hurt myself, but it wasn't, I had my faculties. Someone came and helped me right away. I knew I had to go to the emergency room. So I called somebody to take it with me. But I think the most important part of that whole thing was that I felt in control. I knew that I was hurt, but not my head, and there was no blood. I told my right to Anyway, but I think that's the most important thing is just about disease. In fact, I thought I could drive, but I couldn't because I was sore. So someone drove me to the ER. But I look back on that, and that's how I felt that I was in control of that situation. It made me feel good that, I didn't just lay there on the ground and not know what to do,
Yeah, thank you for sharing that.
Yeah.
It's you touch base on it. It's really important to make sure that we're in control of that moment. Yes, ma'am.
I would highly recommend one of these things,
The life alert or?
Yeah, any one of these, yes, because it happened right in this bill for physical therapy. I put it in my coat pocket. If somebody knocked the coat off the rack, the police were running around. We don't know, I don't know this because I have a wall thing. We're inside wondering what the cops are doing there. And they're looking for me because they got the whole thing. So I don't go anywhere without it.
And that's perfect.
And especially if you're working like out in the garden,
Absolutely, so,
that type of thing.
absolutely.
And it's really quite expensive as far as I'm concerned. And I understand there's, the veterans especially, they have a pretty good deal out there for them, like $5 a month.
Who does?
It's just this thing.
Yeah.
And see, and you press this button and they come on and ask you if you need help.
Then who did you say you got that through that's a good deal?
No, this is a regular one. I know that some veteran friends of mine
Oh,
have gotten it for like $5 or $6 a month for some program. I'm just saying this because, you know,
Which one is that? May I have the name?
shoot,
Okay,
gosh, I can't remember what's name. There's so many of them out there.
I know the.
So go online. They got plenty of information.
I saw one last night for $9.99 a month.
Yeah,
Through
yeah.
Life Alert. Now, they also make apps on your phone too, if you have an iPhone or Android. They have fall prevention apps so that, if you have your phone on you and you do fall, it can alert, 911 as well.
I just want to know if you could wear it in the shower, because if you're in the shower.
No, I could get one to wear in the shower, but I just put this hang it on one of my bars
That's a great question.
while I'm in there.
Yes, sir.
I want to backtrack a little bit.
Yes, absolutely.
In terms of, made a comment about falling and head trauma. Could you speak to the correlation for stroke risk, especially if somebody's on a blood thinner like Eliquis or Plavix or something like that?
So with the blood thinner, any type of contusion or anything, it's going to increase our risk for bruising. Definitely if we hit our head, it's going to increase our risk for brain aneurysms, brain bleeding, and then also it could increase our risk of stroke. Now, if we do have a stroke, that's going to affect usually one side of our body. It's going to be the opposite side of our stroke. That's going to lead to decreased mobility in our upper and lower extremity on the side that it's affected. It's also going to decrease our balance, and it's definitely going to impact our ability to walk, to transfer, to really move independently. Now, all strokes aren't created equal. There's going to be some where people they recover a little bit quicker than others. It really kind of depends on the severity of it, where the stroke is in the part of the brain, and how long you take to really kind of get medical attention. But as far as the Eliquis and everything, I mean, it kind of comes back to if you hit your head after fall, you need to get medical attention. Yep, 911. CT scan will kind of figure out exactly what's going on right away.
Or bleeding, if you have any kind of bleeding that's uncontrolled, any little cuts, just continue to bleed, can't stop it. Within a period of time, you feel safe, same thing. Call 911, try to be safe and sorry.
Yeah. Physical therapists. Alright. So, if you feel like you have balance issues, if you feel like you're in pain, if you feel like, hey, I just want to kind of get an overall check and see how everything's going, physical therapy can really help. What I would do when someone comes in, I'll do an initial evaluation. We'll do a brief medical history, kind of ask you what you have going on, ask about prior falls, ask you if you're fearful of falling, and I'll ask about some deficits that you may be having. I'll ask about the layout of your home. Do you have stairs in or out of your house? Do you have a railing? Tell me a little bit about if you're on the first floor or the second floor. Also ask about just kind of overall feeling of balance and things that you feel like you have issues with. We'll do an examination of balance, and I'll actually demonstrate this here in a little bit. Kind of what we were talking about earlier with the three senses of balance, the vision, the somatosensory, the feedback in our feet, and our vestibular. Us as physical therapists, we're really able to assess that. And I'll show you how we do that. Pretty much, if I feel like there's some instability with a few of these tests, I'll implement some exercises that we can really help to improve that. balance is just like anything else. The more we practice it, the better it'll get. So it's really important, practice repetition, to really improve our balance and our strength. I'll do a walking analysis. Usually that's one of the first things I do. I always look at posture. I look at speed of how people are walking. I look and see if I can see discrepancy in their step length. See if there's anything going on with their hips, their knees, and their ankles. And that can kind of cue me in on a lot of what's going on. I'll assess strength and range of motion. This is really important because if we have a deficiency in our hip, it's going to affect how we're able to stand on that left side, how we're able to walk. Generally, when we have a weakness on one side, we tend to deviate to that side because we're not able to support ourselves. We have some special tests that will assess risk of falls. So we do a couple different things, such as getting up and down from the chair a few times. I'll be able to assess balance with how you get up from a table, how you transfer, and really if you're able to kind of stand on one foot, or there's a multitude of different ways that we can really assess the risk of falling. And then after the evaluation, once I determine what exactly is going on, where we have areas of deficiencies, we'll give you an exercise program specifically tailored to what you have going on. So whether it's a decreased joint mobility issue, decreased strength issue, or just an overall balance issue, there's exercises and different things that we can do to really increase your safety and decrease your risk of falling. I have a couple exercises. I know I gave everyone a handout. I'm going to have Megan demonstrate a few of those. These are all modifiable, and these are exercises that you can do a couple times a day to really increase the muscles, the strength of the muscles that are important for keeping us upright and keeping us steady. Yes, sir.
I did not get a handout.
I have one right here for you.
And there are probably enough extra copies
Yes.
to take home.
Does anyone need a handout that didn't get one? We all good? Alright, so I'm gonna have Megan demonstrate a few of these exercises, and I'm gonna talk a little bit about them while we're going through.
Don't pop their lip.
I know. I get called all the time.
So these exercises.
Okay, so Megan, I'm sorry, but the
I
camera
said,
will be able to get
I'm
through
just
that.
looking, I was looking for you guys. Lay down.
There, that should be good. It's like, okay.
Can you PDF the handout to us or on Zoom?
You
Yeah.
you could send it to me
Yeah.
and I could send it down.
We'll be able to send it to you.
Okay, thank you.
Alright, so this is called an adductor squeeze or a ball squeeze. You don't have a ball at home, what you can do is simply use a pillow. This is going to be really important in strengthening the muscles in our hips that help to keep us upright and help to allow us to get in and out of bed and chair. What Megan's doing is gently squeezing that ball, holding for 5 seconds, and then relaxing. Now this is a very gentle squeeze. You don't have to feel like you're going to pop the ball or the pillow.
Yeah.
And this is definitely something where people are like, oh my gosh, that was really, really hard. It's probably 25% of your maximum strength. And you'll be amazed how that muscle contraction against that resistance can really increase your strength. Now, as we alluded to earlier, this is going to be really beneficial for your strength. It's also going to be really beneficial for your bone density. I can't tell you how many people I have that come and say, hey, I just got diagnosed with osteoporosis. What can I do? This resistance exercise is really, really good for building bone density.
Is it okay to do this laying in bed?
You can do this lying in bed. You can also do this sitting in a chair. So these are definitely modifiable. I wanted to pick some exercises that we can do sitting right here or lying down. It's really whatever you're more comfortable, whatever is more comfortable for you. All right, does anyone have any questions about that exercise?
Good modeling.
Good job, Megan. That was perfect.
I do these exercises every day.
I'll give you resistance bands, whoever would like one. We have different levels of resistance. If everyone would like all three, that's great too. We'll kind of talk about it.
I get these from Walmart, by the way, $30.
Oh.
If you don't want a ball, you can use a pillow too. It's just anything that you can really use as that resistance.
In the kids department?
Yeah. I get a lot of glares from the kids when I roll out the cart with all the balls. I need to Walmart too on that exercise.
So this we can modify it a couple different ways. this exercise, they're called clamshells. This exercise is really important for strengthening the muscles on the outside of our hips. Now, we need these muscles to be nice and strong because these muscles allow us to stand on one leg. When we're walking, we're on one leg for a split second. So if we have a deficiency in this muscle right here, our glute med, when we go to walk, we're gonna have a little bit of a limp right here, and that's something that we see all the time. And that can increase your risk of
I do
falling.
that really well.
So what Megan's gonna do is she's gonna have this belt around her knees, just right below her knees. What she's gonna be doing is bringing her knees out into the belt, just to where she starts to feel resistance. And again, this doesn't have to be anything where you're trying to break the belt. This is something where it's about 25% of your maximum strength. You're gonna try to hold that for 3 to 5 seconds. 3 to 5 seconds, and relax. And you can try 10 reps, and you can try that 2 times. This can be done lying down. It can also be done sitting in a chair. Yes, ma'am.
Is that stretchy or is that?
So this is firm.
It's
Now,
firm.
yes, ma'am. So if you don't have anything like this at home, you can really just use a belt. And we're also going to give you some exercise bands to take home
Yeah, I
as
was gonna
well.
ask if it's okay to use one of the bands.
Yeah, so we're going to give you bands to take home. Really, it just wants to be, you need it to be to where it feels like a good resistance to where you're not overexerting yourself. And when we're doing exercises, it's always a great idea to breathe. I can't tell you how many people are holding their breath while they're breathing. You want to make sure. 1, 2. So that's always a great idea.
When doing these exercises, making sure that you are using both legs equally. So I see a lot when I'm teaching patients exercises that they really feel like they're only pulling with one side or pushing with one side. Try to really make sure that you're focusing on using both legs equally. So you're pushing both at the same time, pushing out, or that you're squeezing the ball equally with both legs.
Great point. Now, we can always modify these exercises to make them a little bit more difficult. These are just some basic exercises that we can do. So we can always do one leg at a time, one leg staying still and the other's coming out. We can also do this on our side as well. Those are a little bit higher level exercises, but if anyone has any questions about those, they can always give me a call or they can come in and I'll help you out. We're going to show you a couple other exercises that you can do sitting in a chair. So the next exercise we're going to be doing, they're called long arm quads. You have a question, sir? So you can do this on the side of your bed, you can do it in your recliners, you can do it sitting in a chair. So what Megan's going to be doing, I'll let you.
Maybe get on the,
That's
yeah.
There might be okay. I can go back over on that side too.
So she's sitting up nice and tall, she's not slouching. She's sitting up nice and tall, engaging her core. What she's doing is bringing her leg up by contracting her quads. And then she's slowly bringing it back down. This exercise is really, really important for building up our quad strength. As we talked about earlier, going down the stairs requires a lot of quad activation. So this is going to help us go up and down the stairs easier. It's going to help us get in and out of chairs easier. And it's really just going to translate to better walking and increase stability on your feet. And this is a pretty easy one to do while you're watching TV or reading or doing puzzles. It's a great exercise to be doing.
Even sitting at your computer.
Yes, on your computer. Absolutely.
Yeah.
So those are some good ones to do either sitting or lying down. I'm going to talk to you a little bit about some exercises we can do standing up. Now, when we're doing exercises standing up, the most important thing is making sure we have something to hold on to. Whether that be the kitchen counter, a sink, or a chair, we need to make sure that we have something that's going to provide us some stability. In this case, we have a plank. So this isn't the best height, but we'll make it work. So I know we had talked about the muscles in our hips that are really important. Megan's going to demonstrate how to do a standing hip abduction. It's kind of like a standing snow. I'll have her show you on both sides.
So with this one, you're gonna make sure that, again, you're keeping up nice and tall, and that all your pressure, your weight is on the one side. When you're kicking out, that you're staying in a small range. So you don't need to be going really far out or feeling like you're keying over. Just staying really small, so just the motion is coming from the hip here, keeping your feet lined up together, so not letting your toes point out to the side.
So when I do this exercise, I always look at the wall, whatever I'm standing in front of. I do a quick check. I make sure my shoulders are square towards that wall. I make sure my toes are pointed forward. I'm standing up. I'm engaging my core. I'm holding on to something, and then I'm just coming out to the side nice and easy. Now, kind of what we talked about earlier, this exercise is super important for strengthening this muscle right here. It's called our glute med. This muscle is really important in keeping us upright and stable when we're walking. So as I kind of demonstrated earlier, if we have some weakness in that glute, we're going to kind of have a little hip drop when we're walking. This is a very, very good exercise to do at home, and you'll be surprised by how quickly you can strengthen those muscles.
Kitchen countertop is usually, best place to do this kind of at home.
Making sure we have something to hold on to. Next, what we're going to be doing are some heel raises and some toe raises. Now, this is also something that you're going to be holding on for balance, and you're going to do this nice and slow. If you feel like, I'll let Megan demonstrate and I'll kind of talk about it. But what she's doing is she's coming up on the balls of her toes and coming down nice and slow. So these are heel raises. This exercise is really important for strengthening our gastrocs or our calf muscles. Those muscles are really important for us when we walk and when we go up and down stairs. Perfect. So as you can see, she's going up nice and slow, and then coming down even slower, because that's when we're really working that muscle, is when we're coming down. That's when that muscle's lengthening. So it's really important to make sure we're not just going up and down. We want to make sure that we're doing it with a purpose. We're going up and slow. So these exercises are all modifiable. If you feel like 10 reps is too much, you can try 5.
Where should you be feeling that when you're on your tippy toes?
All here, sometimes you feel a little bit down here as well, but mainly just kind of here.
So you'll feel it just right underneath the knee where that gastroc attaches to, and you can feel it all the way down to your heel. These muscles are really important for powerful movements and just overall strength.
What about when you're on your tiptoes, when you're rocking forward?
So that's where we're getting to next. So the next one we're going to be doing are called toe raises. I'll have Megan show you this. So this one is where we really need to pay attention, because what will happen is in clinic you'll see people moving their bottom back and lifting those toes up. So we want to make sure we're standing up nice and tall. That's all I can see. Standing up nice and tall, and we're lifting those toes up. You're not going to have much of a range because our ankle can only go up so high. But you're probably wondering, why are we doing this exercise? It's weird. This exercise is really important for allowing us to lift up these toes, our toes, when we go and step over obstacles, when we go up and down the stairs. A lot of the times in clinic, I'll see someone not be able to lift that foot up, and they'll say, hey, I was walking in my house the other day, and I went to lift my foot up, and it scuffed, and then I went down. So this exercise is going to be really important for helping build up those muscles that are in charge of lifting those toes up and allowing that proper foot clearance over curves and going up and down stairs.
That's exactly how I felt.
Yep. So this will be a great exercise for you to do. Yes,
Are
sir.
these last 2 exercises also good for Achilles? Because I have problems with Achilles tendon.
Yes, sir. My man. There we go. So if anytime you have Achilles tendonitis or problems with your Achilles, what you want to do is the heel raises, and you want to make sure that you're going down nice and slow. So when we're lengthening that gastroc, it's really, really working that Achilles where it inserts into the heel, and that's going to help decrease pain. So that's a fantastic question. Also, it's a good idea to stretch. Make sure that you're doing some stretches for your calf. Yes, ma'am.
I don't wear slippers, but I wear Crocs. And sometimes when I'm walking across the floor, my toe will stiff or something, and I will find myself flying forward, but I don't fall. Is this exercise going to help that?
Yes, ma'am. So,
And changing shoes too.
yeah, so
Changing shoes. But the Crocs, is something wrong with
Crocs are okay. You can always put them in 4-wheel drive where you put the strap on the back of the wheel. You just want to make sure that if you hear scuffling, so when you're walking and you kind of hear like a scuff, that means you need to pick your foot up a little bit more. Because that's where it's going to lead to increased risk of falling and hitting that toe. Yes, ma'am.
That's what happened today, because I had to wear Crocs when I was walking in my living room on a rug, and I fell. And that was a year ago. And I ruptured a muscle in my leg and bruised all the way down, and it's just now getting better. So that's why you should not wear
So, like what she's, so Crocs aren't the best idea to wear. I know you like them and they look good.
Well, they're good for my heels too. I don't like wearing regular shoes in the house, so.
If you have heel pain and you don't like regular shoes, I would recommend, I know they're a little bit more specialized, Brooks. Those are fantastic. Yeah. They're comfortable and they're designed for
Modeling.
and that's something that you definitely look into is Brooks or Asics. I recommend those for heel pain and for stability. Yes, sir.
I've got to put off braces on that, what they call, the physical therapist. They told me I had a toe slap.
Yes,
So when I walk, it's slap.
yes,
And this brace is designed to,
yes.
with, really energy. It works fantastic.
That's perfect. So that's called an AFO. It's an orthotic that people use. So what this gentleman was saying over here was when he walks, that foot is slapping like this. Now, there's a lot of reasons why that can be occurring. If you feel like that might be happening, it's always a good idea to come to physical therapy because a lot of the times that can be coming from your back. It could be as simple as some weakness in the muscles that are in charge of lifting those toes up, such as that anterior tibialis muscle. So that's a great thought, sir, because that's something that we can definitely delineate what's going on. But in his case, he has that orthotic that helps to lift that toe up when he goes to walk. So that's a fantastic point. Thank you for bringing that up. But this exercise that we just demonstrated is really going to be important for helping to get that proper foot clearance and helping to prevent that foot slap when we go to walk. So thank you for bringing that up. The next exercise we're going to be doing are called mini squats. So this is really important to pay attention to. I'm going to have Meg demonstrate this. This is something where we're going to be holding on to something such as our kitchen counter. We'll bring a chair up here. Now, mini squats are really important because this is one of the most functional exercises that we can do. This is going to help us get in and out of chairs. It's going to help us get in and out of bed, in and out of cars. And it's just good for overall strength and endurance. So I'll have Megan demonstrate this and then we'll talk about other things as well.
So when I'm doing a squat here, I'm gonna make sure that again, you're keeping your feet nice and good slant, about hips width apart, and that you're going back, what you're trying to do is to sit in the chair. So think about making sure you're taking your butt back, is what I say all the time. Think about taking your butt back, doing just a small range, and standing back up. Make sure you're standing up all the way nice and tall, squeezing your glute muscles, and then just repeat. So I can hold onto the kitchen counter is usually where I tell patients to kind of do this. That way you have a little bit of ledge, something to just kind of rest your hands on. Going back. Your weight, you should feel it's going to go under your heels, and then standing back up all the way nice and tall.
Can everyone see what Megan's doing? Now, this is really important, especially this can help with knee pain, back pain. Really, it's one of the most functional exercises we can do. When you're doing this, you want to make sure that you're not going down too far. And kind of as Megan alluded to, you want to make sure you're bringing your body back, kind of like you're sitting down into a chair. When I do this exercise, the first thing I do is I look down at my toes to make sure my knees aren't going past my toes. So if you feel like you're bringing your weight forward onto your toes, we're doing this wrong. We need to make sure that we're standing up nice and tall, engaging our core, and bringing that bottom back first so that our weight are on our heels, and we're really targeting these quads and these glute muscles. Does all that make sense?
Yeah. I remember it really helped me to be thinking in terms of pushing my bottom back and feeling it through the heel.
Absolutely. Okay. So if you're feeling, hey, I'm doing this exercise, I'm feeling it mostly in my feet or kind of below my knee, means we need to modify it a little bit more. We need to bring that bottom back because we really should be feeling it in the quads and in the glutes. Does anyone have any questions about the squats?
Also want to say, if you are doing it from home, always suggest getting a chair, something behind you, especially if you're not sure, you feel unstable with doing these when you're just starting, have something behind you just in case. If you lose your balance, you'll go back to a chair as opposed to going back to your bottom of the floor. That's not something I'm doing.
Yes, ma'am.
I do these, but I use a bar that I hold on to.
Bar's fine.
Is that it?
Bar's perfect. I love that idea. It's fantastic. Next, we're going to be demonstrating some balance exercises that you can do at home. This might be a little difficult because we need a corner, but we'll make one. So this is something to do if you feel very comfortable. This is called the triangle of safety. It's kind of corny, but I really like it because it makes a lot of sense. What you're going to be doing is you're going to be standing in the corner of your house. You're going to be standing with your back facing the corner, and you're going to have a chair in front of you. Now, this is really how to increase our balance and stability. So what Megan's doing, we're going to pretend this is a corner of her house. That way, if she loses her balance going back, she's just going right into the corner. It's not going to hurt anything, and she's right there. That way, if she loses her balance going forward, she has the chair there for stability to hold on to. So what Megan's going to be doing is we have a couple different positions. These are all modifiable, so we'll start with the basics. What she'll do is she'll stand here, up, she'll stand up nice and tall, feet shoulder width apart, and she'll just keep her balance. If you feel like that's pretty easy, what you can do is you can close your eyes. Now, as we alluded to earlier, we rely on our vision for balance.
And then you can stand on one leg and.
So we'll get to that. So I can't tell you how many times people come in, they say, my balance is fine, I'm rocking and rolling, there's nothing wrong. I'll say, okay, let's see what we got, and I'll have someone close their eyes and they'll say, oh my goodness, that is very unsteady. So this is always a good thing to do. You can have your feet apart, eyes open, if that feels easy, eyes closed. Now, this is where we get to the fun part. When that feels like, hey, I feel like I've kind of mastered that, we can modify some things. So instead of having our feet apart, we can bring them together. When we bring our feet together, our basic support is smaller, so our area of balance is smaller, and it's going to allow our body to have to work that much harder to keep us upright. So like Megan's demonstrating, she'll stand in the corner, she'll have the chair in front of her, she'll have her feet apart. We'll do that for 20 to 30 seconds, whatever you feel comfortable with. And then once that gets easy, we can stand with our feet together and our eyes closed. And you'll be amazed how much of a difference and how much more instability you'll feel through your hips and through your ankles when you do this exercise. Another way that we can do this at home is once you feel like you've mastered that, you can bring one foot staggered in front of the other. Now, this one is going to be challenging because when we have one foot in front of the other, the foot that's in the back is going to be bearing most of the weight. So we're essentially standing almost on one leg. So you'll be surprised. People will say, oh my goodness, I really feel this on my right side. So that's because most of your weight's going to be on that right side. And this is a very good progression. So you can do this with your eyes open. And if you feel comfortable, you can do it with your eyes closed. Does anyone have any questions on those? And then once you've mastered that, once you've mastered standing on a firm surface, there's always ways to challenge balance. So if you feel like that's pretty easy, what you can do is you can stand on a foam pad or a pillow to make it an uneven surface. Because when we're standing on uneven surfaces, it's challenging our balance even more, and it's essentially taking away the sensation and feedback that we get from our feet out of the equation. So with balance, I always tell my patients, they say, why is this so much harder? Well, when we're standing on an uneven surface and we have our eyes closed, instead of having three systems of balance to rely on, we're really only having one. We're having that vestibular system because we're taking away your vision and we're also taking away essentially your feet because it's an uneven surface. Does all that make sense? So there's a lot that goes into it, but the biggest thing that you can take away from this is that we can increase your balance through exercise and activity. There's always ways to strengthen your balance. It's just like playing baseball. The more that you do it, the better you'll get at it. The more your body will adjust to it. Does anyone have any questions about any of those exercises that we went through? Probably. So to kind of tie everything together, there's a lot of factors that can increase your risk of falling. I know we identified a few, we kind of touched base on a few. Really the biggest thing that we can take away from this is strength training, balance training, and just overall activity. It'll increase your strength, it'll increase your balance, it'll improve your quality of life, and it'll increase your confidence and decrease your risk and fear of falling. It's something that you need to keep up on. I always tell my patients, it's always a good idea to do something every single day, whether it's walking around your neighborhood, whether it's doing a couple exercises. Our body is built to really require exercise and activity. And the more that we do that, the better we'll feel, and the more we'll want to continue exercising.
Is walking sufficient or bicycling sufficient? Does it need to be combined with these sorts of things?
That's a great question. I like cardio training and strength training. Walking's very good, but if all we're doing is walking, our body kind of naturally adapts to that, and it's not challenging it enough to really build that muscle and kind of create those adaptations that our body needs to get better. So it's always a good idea to walk. After walking, we can do a couple of these exercises, and we can do a couple stretches. If you do that a few times a week, and maybe throw in riding a recumbent bike or going on a bike ride, that's going to be fantastic. Because as we talked about earlier, it's important to kind of create variety within our workouts. Don't be afraid to reach out. If anyone has any questions, it's always a good idea to contact a physical therapist, contact your doctor, go online and look for information. And there's so much information out there, and it's really designed to make everyone feel safe and really improve your quality of life and decrease your risk of falling. And last, we can help prevent falls. So hopefully this is a little bit beneficial for you guys. Thanks for listening to me ramble on. And I'll take some questions. Yes, sir.
So I have a question.
Yes.
I think a lot of us are at an age where we wake up every morning with pain. I like my doctor a lot. He has a tendency to pull out his prescription pad and put a Band-Aid, a drug Band-Aid on the pain without diagnosing what the pain is. And you alluded to earlier that pain can cause some instability.
Yes.
So is there a way that I could call your office and make an appointment to do some preventative stuff? First of all, to diagnose what's causing my pain. And then how can we put together something that would, try to help me alleviate that pain? Do we call you directly, or do we need a referral?
So if you have, that's a great question. So let me answer your last question. If you have Medicare insurance, you have to get a referral from your doctor. But generally, it's really easy. You can just call your primary and say, hey, my back hurts, or I'm fearful of falling, and I feel like my balance needs some improvement. They'll give you a
Or
referral.
sometimes they have only a certain number of sessions, and that's why we asked Barb to be here today too. And Barb's here from the Y, and the Y has some programs that can help with this as well, that you can talk about here as we finish.
So we go hand in hand. So my job as a physical therapist is to diagnose exactly what's going on. So if you come in and say, hey, my back's hurting, I can figure out exactly what's going on. Based on that, what we'll do is we'll do some soft tissue massage, we'll do some manual therapy, some stretching, we'll combine that with strength training and flexibility. And then we'll, of course, do some exercises for your strength, for your overall mobility. And then if you feel like you have some balance issues, we'll diagnose that as well. Now, what will happen is once you get to be pain-free and you feel good, we're going to transition you to a home exercise program such as the Y to really continue to do what we've built upon and really get even better. Does that help you out? Yes, ma'am.
So I've been going to PT since I rotate up. And I said to the therapist, I said, I really would like to incorporate some balance, because I know it was my balance that made me fall. There was absolutely no reason for me to fall. It was that, just like you described. So she said to me, well, we usually don't incorporate Medicare, doesn't, like to have the balances separate and it was kind of a put off. And I thought to myself, well, now how do I progress? Do I need to go someplace else? Is there, in California, they had balancing classes all the time, and it was never an issue. I can't seem to find anybody here that can help me.
So
She can here.
right here will help. Also, so they have dance classes here. Also, where I work on the road in Tidewater, we offer balance exercises and balance.
And do I need to get something from my primary care?
If you have Medicare, you need to get a referral from your doctor, and that will take care of that.
Okay.
Yes,
What
sir.
is your general recommendation on compression socks?
For compression socks,
Yeah, I just have always used them for flying.
I like compression socks, especially if we feel like we have decreased circulation or swelling. It's going to help to decrease that. It's also going to help to increase a little bit of sensation in our extremities. If you have any questions where you feel like, hey, I don't know if this is detrimental to my health, you can always contact your doctor and say, hey, I started wearing compression socks a couple weeks ago. Is there any reason why I shouldn't be doing that? But I think you'll be fine with compression socks. Yes, ma'am.
What is your recommendation when someone goes to Walmart and buys a cane to know how to use the cane?
That's a great question. So I can't tell you how many people come in and they say, oh my gosh, my left knee hurts. And the first thing I see is they have it on their left side. So I'm glad you brought this up. If you have any questions, it's always a great idea to see a physical therapist because it's kind of counterintuitive when you have an issue on, let's say it's an issue on the left side, you always want the cane on the opposite side. And then also where getting the cane comes into play is, all right, how high is it supposed to be? Where am I supposed to put it when I'm walking? How am I supposed to walk with it? How am I supposed to go up and down stairs with it? There's just so many different factors that go into that. And that's why it's as simple as just giving us a call and saying, hey, I just got a cane. I don't know how to use it. I need some help. And in a couple sessions, you'll be rock and rolling. Does that answer your question, ma'am?
That's
Anyone?
great info to know.
Yeah.
People just don't know what to do with the cane.
And it's just as simple as a quick modification, gait training for 30 minutes. And I'm like, oh my gosh, my knee feels so much better. I feel more stable. And it's fantastic. Yes, ma'am.
It's the same thing with walkers. If your family member loans you a walker, what happens with walkers, you're leaning over, so now you're halfway into a fall. So if you're trying to use it to help with a fall, you're already, if it doesn't fit you appropriately, you're already halfway into a fall.
Yeah, exactly.
So it's like everybody tries to help everybody, but if you don't go to a professional or get a referral from your physician so he knows what you're doing, and then get, like yourself, a professional that can help. But all these different helps are there, but need to be, and, even in the emergency room, a person gives you a set of crutches. Well, if they don't fit you in the emergency room, you say, I need you to fit me for these crutches.
Absolutely.
Because then you're getting all kinds of other effects. So it's their helps, but they also can be very, very crucial.
Absolutely. That's a great point. Yes, sir.
I'd just like to give a shout out to Jake. I've been going in for I guess about 2 months now. I've been working on my core. When I started there, I had a hard time. Actually, I was using a walker. So we're pretty much at the point now where we can get by. And I use a cane, but it's more for balance than anything else.
Well, you must be working hard at it. There you go.
And you haven't lived until he gets you on the trampoline.
All right, I've been there. So, I want to give a chance here for Barb to talk to you a little bit about the programs that the Y offers that are tangential to this. As Jake has been saying, you might start with a physical therapist, but you run out of those, they're not gonna, your insurance is gonna pay for you to be doing that for 2 years. And then it's time to go to Barb.
2 years, okay. Really goes that or what, 30 visits maybe or something? Yeah, I know, really, we need to talk more. We do just, when people are going to physical therapy and they finish physical therapy, there are many times like, well, what am I supposed to do now? And I am so blessed to be able to teach a program that is called Enhanced Fitness. It is here offered at the YMCA. It is a program for older adults, and that program has been designated as a fall prevention arthritis management class. It's not a drop-in class where you come in and you might see some 40-year-olds in there dancing all around. This is a program that is 60 and above. It is truly, it's just an amazing program, but it is an evidence-based program. So as an instructor for enhanced fitness, I had to be trained. I had to go through training to be able to teach this program. It is very structured. The only thing as an instructor that I can do that's my own is the choreography for the cardio. Everything else is truly in a book that the exercises that he has shown us today are many of the exercises that we do in the enhanced fitness program. I do balance exercises, very specific balance exercises, very specific strength training exercises, and the same with the stretches at the end of the program. So
do people have to be evaluated before they start? Can they start in mid, is this a program that every day is a different group of people?
no. Honestly, people that come to enhanced fitness, I can't get them to leave. And I just started in January a second class. I split my class because it was just getting a little bit too big. But the program, you actually have to do an enrollment form. We do evaluations on week 1 and again on week 16. There are 3 fitness checks, just simple fitness checks that we do. To just kind of see where you are, and then at the end of the 16 weeks, we're gonna do it again because I want to see the progress that you have made. I'm thinking about one of the ladies in my class who went to the doctor, and the doctor's like, I want you to get up on the table, and she's like, and he's like, oh, that was really good. You were able to do that on your own. She goes, yeah. He's like, so what do you do? She's like, oh, I go to this program at the Y, it's a exercise program. He's like, well, you keep doing that. Whatever it is you're doing, you keep doing that. I hear stories like that almost every day in my program from the participants saying, I just have to tell you, they won't say it out loud in front of the whole group. They'll come over to me after class and say, I just want to let you know that, I was able to do this or I was able to do that. It's an amazing program.
Well, great, thank you so much for telling us about that.
I did bring a little, if you're interested, because it's not a drop-in class, this gives you a little bit more information about the enhanced fitness program. And we have a sheet here, this is called a fact sheet, so this gives you more details that's done from the Y. This is a program offered nationally, it's not just something locally.
Well, how often do you start every one?
It depends. If I have several people that want to join, I'll probably try to put them all together and bring them in at the same time.
Okay, so if you get 10 people from our room here saying they want to do something, then you'll keep in touch with them and figure out.
I try to get people in sooner than later, because if you're interested in joining this program, I'm not gonna say, well, in 2 months from now, we're gonna start a new session. I wanna get you in now because I don't want you to come back and say, oh my God, I was gonna take the class, but I had a fall.
So our 2 physical therapists over here are busy cutting at bands. Can you tell us the difference in colors?
So we have different resistance bands. We have orange, which is the lightest, pink, which is the second, and then green, which is the heaviest. Please feel free, we'll pass them out on your way out. If anyone would like all 3, that's fine. When you feel like, let's say you started orange and you feel like orange is a little too easy, you can progress up to pink, it's a little bit harder. Then when that gets easy, we'll go up to green. So it's all about always continuing to kind of work on that strength and make things that are, make your body work a little bit harder. When you feel like it's not too much of a challenge, you're ready to go up to the next step.
So what else do you have over here?
We have all sorts of goodies. So we have some stress balls, some water bottles. I have a couple cards here if anyone would like to take the card. We have some frisbees if you have some puppies at home or some grandkids. I'm gonna take a couple frisbees in for my puppies. If feel free to take whatever you'd like. Thank you everyone so much for taking time out of your day.
Thank you.